but it's true.
Yeah, don't say that.
So we do welcome her to her new post as the Deputy Director of Maternal, Newborn and Child Health at the Bill and Melinda Gates Foundation. Mariam.
Thank you so much, Jennifer, and thanks to all of you. It really is a great honor to participate in this important and very timely launch of an impressive body of work and to see so many distinguished peers, colleagues, and partners here today. In fact, I think we are all very encouraged by the fact that measurements play such a central role on the global health agenda today. On our end, at the foundation, this year, the annual letter of Bill Gates really focused on measurement, and in particular, how important measurement is to improve the human condition. We need measurements, as you all know, to know what works and who benefits. But the fact brought out also by the body of work we are here to look at today, we all know that rigorous measurements of the proportion of women and children in need of life-saving interventions who actually receive those interventions remains a challenge. And that's why this day today is so important. Over the past decade, as Elizabeth pointed out, the global health community has made impressive strides forward and dramatic declines in child mortality. But we all know that 7 million children, less than 5 years, are still dying each year, and maternal and neonatal deaths are declining even less rapidly. So effective interventions do exist that could prevent many of these deaths. In fact, based on some of the work by CHIRG, USAID, and UNICEF, we believe that we could bring down deaths by 2/3 by 2030 if we continue to keep the pressure on and accelerate intervention coverage. But unless we know where those interventions are missing, we can't really reach those women and children who are most in need of them. We think that this report today is a very important step to systematically review and identify the best ways to know where the interventions exist, where they are missing, and where they need to be strengthened. We think that there is actually no better or alternative way of finding that out than to do well-conducted intervention coverage surveys. Can we do better, which is the question posed by the team today? Well, strikingly, and this was an eye-opener to me, only 11 of the 75 countries that account for 95% of all deaths among women and children have recent data on such key indicators that are recommended for global monitoring by the UN Secretary General Global Initiative, Every Woman, Every Child. The analysis that's done for this collection of articles show how important high-quality household surveys are to monitor progress towards national and international health goals and to keep us partners accountable. Importantly, the information gathered in these surveys here help to identify the pockets of underserved populations and identify effective strategies. The authors note that the surveys like the Demographic Health Survey and multiple indicator cluster surveys could be supplemented by lighter lifts, something that could be implemented more frequently and complementing the routine household surveys. The surveys focus on indicators that provide valid measurements to inform decision makers, such as indicators we need more of, neonatal interventions and postnatal visits. But they also point out that there are some of those indicators we currently use that we could do better, that could be improved. In fact, this collection reminds us that much remains to be done about how to best measure coverage of maternal neonatal child health interventions through household surveys and how to complement those with health facility assessments. They actually outline to us a learning agenda. This report, we hope, will motivate all of us to build on, extend this work to find options for further improving current metrics and validate new indicators and modules to better reflect reality. We will continue to need population-based household surveys because they are actionable, because they can enable real-time analysis, and they should have large sample enough to enable disaggregation by gender and income on a routine basis. Some would rightly argue that isn't the way to go more investments in vital statistics and health management, health information management systems? Clearly, yes. We need to generate data that programs need to set targets, assess progress towards goals and targets, make course correction and adjust. I don't think none of us would disagree that we do need vital statistics, we need better health management information system and other systems generated data. But most low-income, mid-income countries don't have those core functions. And even when they have, we will still continue to need solid, rigorous household survey data to validate the kinds of information that comes out of routine data sources. And that's why we think this is so important, that our focus here is on household coverage surveys. Can we do better? We're doing pretty well, as the data shows us, but yes, we can do better. So thank you, Jennifer, and all colleagues here for this contribution today to find better measurements and measures of coverage of maternal and newborn and child health. And we'll continue to learn by doing. Thank you.
Thank you.